Kids Health Watch with Dr. Sang is sponsored by Sang Pediatrics.
Every month we focus on children's health with local pediatrician Dr. Nu Sang from Sang Pediatrics in Fresno. Dr. Sang, thanks so much for being with us this morning.
Kim, thank you again for having me.
We are talking about so many aspects of mental health today that we would like to share some insight and help families out there. There are so many different types, that we could talk about, but we don't have tons of time. So
That's right.
We're going to try to really focus on the pandemic and how it impacted children. And as a pediatrician, what have you mostly seen in terms of changes with your patients?
Things have gotten worse. It was bad before. It was bad before, and it's gotten worse. There are a record amount of children now hospitalized for mental health illnesses, and just downtown Fresno, we have tons of kids, more than asthma or heart disease or anything like that, being hospitalized for mental health illnesses. And so I wanted to come onto the show to try to give the audience resources and know that they're not alone and that maybe, we can help.
Thank you.
Yeah.
Before the pandemic, what were you mostly seeing?
Like the 2000s was very impactful for children's mental health, and maybe we got better at diagnosing it, and maybe we just, maybe it just got worse on its own, but suicides increased, and suicide attempts and ideation and all that was worsening right before the pandemic, and it seemed like the pandemic just had a collective trauma onto the society, and it just made things worse.
What's ideation?
Ideation is when you think about it. You fantasize about suicide.
I see. Okay.
And sometimes when they have a plan, they can be a danger to themselves or other people.
Okay.
Yeah.
You talk about the pandemic. That certainly was trauma. It made things worse. So did you see then numbers of those things like thoughts of suicide and ideation and the such going up then in the 2.5 years?
Absolutely. And that's shown by the statistics in the hospitals. The children's hospitals were filling up with mental health problems.
And so much can come from the pandemic in terms of trauma, the litany, it's just huge. So what have you seen with your patients in that?
I think the former Surgeon General of California, her name is Nadine Burke-Harris, she summed it up best, and she said that the pandemic was unique in that it was a source of trauma, but it also took away means to cope with it. We weren't able to see grandma and grandpa. We were afraid to spread the disease to them. And so mitigation efforts were difficult, and we're social people, we're social animals. So we need social interaction. The fact that we're here now, we couldn't do this 2 years ago. We couldn't. We couldn't be in the studio.
Right.
And so now we can. So it's getting better, and now we can look back on the pandemic and kind of pick up our pieces.
We've often said that children are so resilient.
Yes.
However, trauma certainly can have long-lasting effects. Like what?
Well, if we're not careful, we have trauma comes in many forms, right? You can get the parents divorce. Move to a new school, something like that. But if they accumulate, it can cause toxic stress, and the body is pumping out stress hormones all the time and thinks that's normal, because the kids' brains are not wired yet, but then they get rewired and they think that their body's stressed out all the time. And if it goes into adulthood, it can cause things like heart disease, high blood pressure, asthma attacks, and suicides increase by 37 times if you have too many of these adverse childhood events.
So what can we do?
So I want everybody to know that you're not alone. These things happen. It's not anybody's fault. We don't want to put energy into assigning blame. I want everybody to go see their pediatrician, screen for these adverse childhood events, use the pediatricians and the doctors and the mental health professionals that are available in the area. Fresno State actually has a program, right? Fresno Family Counseling Center. They are taking new patients. I talked to the head, and he's happy to help. But also be a good role model for your children. Take care of your own mental health as a parent, and set a good example for your child, and they will get through this.
Yeah, really talking about it and admitting, I've been having hard times, or these are some thoughts I'm having, and letting the children know that we are certainly not Iron Man,
Right, everyone thinks they're superheroes all the time. We all watch these TV shows, But really being vulnerable, admitting that you need help is the first sign of getting help.
Yes.
Yeah.
All right, taking that step. Thank you so much, Dr. Sang. Really appreciate your time.
Thank you for having me on.
Thank you. Well, again, if you would like any more information, or maybe you'd like to watch this segment again or contact Dr. Seng, just log on to kmph.com and click the tab labeled Kids Health Watch.